Hello everybody, I'm Hannah Witton. I'm a content creator and author, and I also happen to have IBD, inflammatory bowel disease, ulcerative colitis to be specifically, and I'm here with Be Part of Research with Matt Brookes.
Hi Hannah.
Hello.
I'm Matt Brookes. Lovely to meet you, and it's great to be here. I'm a gastroenterologist in Wolverhampton. I'm a professor of gastroenterology there.
What is currently happening in the world of IBD research? What are the key areas that research is looking into at the moment?
Well, this is my passion, so I can go all day on this. So IBD research is been, it's been a real privilege in my career to be involved in it, because it's been one of the most exciting periods of research for a condition like this. The last 20 years has seen us really start to develop a huge number of new drugs. So 20 years ago, when I started as a junior doctor, with IBD, you came in, you either got steroids or surgery. That was it. Now, it's like 16 or 20 different medications, all of them targeting specific different signaling proteins, all these new biologic drugs, all these advanced therapies. So what we've seen is this explosion of research trials. The things that everyone really understands as a research trial is like a new drug versus a dummy drug. And that's been 20 years of that. And where we've got to now is we've got to a phase where we're really beginning to understand, I think, a little bit more what patients now need, and really starting to try to understand what's important to them. So there's a lot more research now on diet, on well-being, on exercise, on sex, on pregnancy, and all the things that probably we've been so focused on, these amazing new drugs and these amazing new medications. And one of the things that with it, because it's such a complex, congested space with all this research, one of the things that's really helpful is this new registry we're talking about today. So this research matchmaking opportunity, Be Part of Research, because people can actually go and hunt the type of studies they want to do.
Yeah.
And that didn't happen before. You were lucky because you were in a big hospital or a big trust, and you got their research. And if you weren't in those hospitals, you couldn't access it. Whereas now, it's there for all.
I love hearing about all of the different places that research is going to now, especially like in terms of what patients are wanting and asking for. I've had UC since I was 7 years old, and so I've also met lots of people with IBD, and I know that one of the biggest things when it comes to any chronic health condition where there is, quote unquote, no cure, it's about quality of life. You've got to manage the symptoms, but then also how is that impacting, like you said, your mental health, your sex life, your family life, work, relationships, all of these different things.
Yeah, and a lot of the studies that we've done, they measure these very specific components around quality of life, but they're kind of unique things, and they don't always give you that insight. So a lot of the listening to patients and really beginning to adapt studies to meet the patient's needs is very much about co-designing those studies with patients. So actually listening to the types of things that are important, and then as we do studies now, we do these kind of prospective observational studies, and what that means is we're actually looking at people and following them in their normal clinics, but getting that extra insight into how the inflammatory bowel disease or the ulcerative colitis impacts their life, their sex life, even things like work. Work is really, people find it so hard when they've got a condition like this and they can't work because they don't feel like they have that ability to be productive. So studies looking at that are really important as well. And another area we're looking at the moment is mental health, which is really important in this space. And again, probably has been a bit underserved. And again, coming back to things like Be Part of Research, there's a real opportunity that if you have IBD or ulcerative colitis, and you say, I want to find research on that and mental health, then if you sign up, put your details in around the conditions you've got, and then you can match yourself to the types of studies you want to be involved in.
Yeah. What have been some of the recent major breakthroughs or developments in IBD research?
So I think a big area that we've, I mentioned these biologic drugs. what we've learnt from all of that is all these amazing new drugs, and they're fantastic, but probably only 40% of people respond to treatment with one of those drugs. So in any of the studies that you happen, you get 40, and we don't really understand, or we didn't really understand why that was happening. What we're now starting to do is to look at what we call personalising therapy, and so we're looking at why people respond to certain types of drugs, and what we're doing to try to achieve that is looking at things like the bacterial makeup in your gut, other factors, other environmental factors, and trying to be able to use that to predict how you will respond to different therapies. So there's a study that's ongoing at the moment, and if you go on to be part of research again and you search different studies, there's a huge number of inflammatory bowel disease trials on there at the moment, but one of them is again an observational study looking at, it's called PREDICT, and it's specifically looking at this issue around why do certain people respond to different drug therapies, and following them over time. So you give blood samples and poo samples and questionnaires when you're going to have your treatments, and they track that, and they look at people who respond and don't respond, and then look at the bacterial makeup of the gut, and to see whether we can actually identify a specific bacterial makeup of your gut to be able in the future to say you will respond to treatment A or treatment B.
Oh, that would be brilliant. So like I said, I was diagnosed when I was 7. So I feel like I've, as a patient, seen so much change in the treatment that's been available for me. I remember when I was 15, so this would have been 2007, I had infliximab for the first time. And the doctors talking about it as if this was like a new, very experimental kind of drug, because previously, it was all steroids. And that kicked me then into a 10-year remission. Incredible. 10 years later, I then have a big flare-up, and suddenly there's 3 new biologics for me to try, not just the infliximab. But none of them worked that time.
Yeah.
Why?
and that's exactly what we want to be able to do is, if we could, not that we can take you back in time, but what would be amazing is, and now we know those drugs work in certain people, is being able to say, your infliximab stopped working. Let's take a poo sample and a blood sample, and we'll look at that and we'll say, well, actually, you need drug X, Y, or Z, because that'll work for you. So I think that's where the future's going. What's really interesting about infliximab, it's one of the first studies that I ever was a principal investigator on, so I supported. Cool. It was amazing. So it was a study that was run out of Cardiff, and they looked at infliximab versus the previous drug called cyclosporin, and the old drug was really complex. It had a lot of side effects. It was really difficult to give, just because of the way that you had to make it up for the patient on the wards and the dosing schedule. Whereas infliximab came along, it was dead easy. So Construct, which was this first trial looking at these 2 main drugs, was amazing, because it showed, although it showed that the 2 drugs were equally effective, it meant that we could give infliximab first, because it was easy to give. And actually then you didn't have any delays because of the complexity of the drug. You could treat people really quickly, really early on. So it became the definitive treatment. So you benefited from the trials on infliximab.
Yeah.
And imagine if you go back in time that they wouldn't have been there. Those options weren't there. It was just the steroids and surgery. So yeah, the infliximab trials that originally were really exciting to be involved in.
Yeah, I was pleased to receive it. You mentioned research around mental health and diet and pregnancy. What are the key findings, I guess, that have been coming out of that research relating to IBD?
Yeah, so lots of exciting signals of things in this area, but also lots of work to do. So if people do want to get involved, again, just go back to be part of research, sign up and get on there, because that's where you'll find all these new studies that are coming, and there's lots going on. So we've just been, I'll talk about mental health initially. So there's been signals of associations between mental health and IBD, and there's this question around causality. So what is it? Is it mental health? Is it drugs that are used to treat depression? Are they linked with inflammatory bowel disease? Or is it the other way around? Is it because you have the condition and because of all the inflammation, you're much more at risk of getting inflammatory bowel disease?
Or is it not the symptoms of the disease itself, but actually the inaccessibility and the stigma in society around the disease that causes mental health problems?
Yeah, absolutely. And that sense of isolation, and that drives all the anxiety. So trying to understand and unpick that is really complex. What we do know is that there is an association between the two, obviously. I mean, it's something that so many patients say, but also some of the early studies have demonstrated this association. What we're looking at actually is, again, going back to those people who respond and don't respond to drugs or lose response to drugs like you did with infliximab. And what we're looking at is, again, we're looking at these observational studies going forwards, collecting data to look at what comes first. And is there an association between depression, anxiety, mental health problems and loss of response to the drugs? Or the initial response to the drugs. So are you more likely to not respond to the drug if you have depression, anxiety or mental health problems? And if you lose response, are you then more at risk of getting complications in that area as well? So this is a study that's recently been funded by NIHR. It will also be part of research, so you'll be able to search that out, and we're setting up sites at the moment. So that'll give us some insight into that. But certainly there's a link between the two. It's now beginning to just unpick how and where the relationship is with inflammatory bowel disease and mental health.
Do you ever do research that's like the other way around? Because so I've had IBD since I was 7, but I've never had depression or anxiety or experienced any mental health issues. So yeah, is there a way of looking at it from, okay, you're higher risk, but what about the people who don't develop those conditions? Is there something you can learn there?
Yeah, and interestingly, I think you when you do these studies, you often collect, there's a really interesting positive spin on it, because a lot of what we do about research is it feels like a bit of a negative spin, because we always look at we're always looking for the people who don't respond or don't fail, but actually that's a really positive way of looking at it. So we collect that data still, because they're in that cohort of people that we're collecting. So it's for example, with this study, it's everyone who goes onto a biologic drug, and then we follow them to see how and when they lose response. But we also do questionnaires to assess and evaluate their mental health. So the people who don't suffer will stay in that journey, and we can look at that. And it might be that we have to just think about how we talk about some of these studies and put more of a kind of positive angle on that.
Yeah, okay, interesting. And then what about with pregnancy? I've been pregnant before, granted, when I had a ileostomy, but I still experienced some inflammation in my rectum. So very curious about this, because I also receive messages from people sometimes who have ulcerative colitis or Crohn's disease, asking about, kind of talking about their fears around getting pregnant when they have the condition, and what if they have a flare-up whilst they're pregnant, and or if they're currently like managing symptoms, is it safe for them to get pregnant? I think a lot of people have all of these kinds of questions and worries.
Yeah, and again, it's a massive space. I mean, we could spend hours talking about this alone. It's really interesting. I think it's an area that has not benefited a lot from us targeting research on it, over the last 20 years. But I think the last 5 years, we've really seen a big explosion. So it's an area we've looked at as well. There's definitely signals of, so you absolutely can get pregnant with inflammatory bowel disease. Ideally, the best thing to do is to engage with your healthcare providers as soon as possible, to tell them that you want to consider conceiving. And a lot of the sites now have, a lot of trusts and sites now have preconception clinics specifically to try and help provide advice on this. The best thing to do is to try, and you can't always do this, but you try to become pregnant when your disease is in remission or under control, because that gives you and your baby the best possible outcomes. And the chances then of a safe and complete pregnancy are really, really high. So there's a lot of anxiety and fear, and a lot of the work that we looked at was we are clearly not providing the education and support for patients as healthcare providers, and that's what our research identified, that the messaging doesn't get out there, and that actually what the fears and beliefs and the anxieties of patients are generally unfounded, but that's largely because we're not giving them the right information, and that's some of the work we've been trying to do to try and improve this. And great places to go are places like Crohn's and Colitis UK.
Yeah.
And I'm sure that there'll be more and more research coming in that space, and again, the opportunity to look at studies that are specific to you all comes through those registries like Be Part of Research to help you find, if you want to look at pregnancy-related inflammatory bowel disease studies, that's the area to go.
What about postpartum? Because I found, this is for me personally, that my inflammation was very under control during pregnancy. Pregnancy is a natural immunosuppressant. And then it was the first 3 months postpartum that my inflammation really flared. And then it settled down again. Is that something you see? Is there any kind of carry-on research care that takes you beyond pregnancy into that like initial postpartum period?
Yeah, no, it's absolutely what you experienced is I wouldn't say a lot of people. So we see about a third of patients can get a flare up in that postpartum period. It's probably the highest risk phase. So it's a really interesting time. It's really hard for patients. I mean, I cannot imagine how much of a pain that was for you, struggling with a baby and a flare-up. It must be a nightmare. So I do think that, again, is an area that we've not really studied. Both the qualitative research about understanding the patient's needs, about that complexity of balancing potentially a new family and a flare-up at the same time. So I don't think we understand that as well as we should. And I don't think we understand what it is that definitively triggers it. But what we are quite good at is, I think because of the new drugs, we are quite good at trying to respond fairly quickly to the patient's needs in terms of managing the flare now. And in the past, that was harder because, again, it was go back to steroids and, you're back to square one again. Now, with the newer biologics, it might be, increasing your dose, switching to a new drug and trying to get it back under control quickly. So hopefully it's not, you're not suffering for as long as you used to.
Yeah. Okay. So in a previous life, I was a sex educator. And so I have to ask about the impact of IBD with sexuality, sex and relationships, that side of things, because that's something I also have done my own little research into.
Yeah, so there's associations with a lot of kind of quality of life, really. Sexual dysfunction is not uncommon. It's certainly more common than the general population in inflammatory bowel disease. And there are studies being developed in this area at the moment to look at that sort of sexual dysfunction and how we can improve care in that space. I don't have a lot of the kind of details and information on that at the moment, but I do know that there are investigators who are developing studies. And again, keep an eye out for those, because if it's something you're interested in, then they will end up on Be Part of Research, which is your kind of access in. And the important thing is, if you can't get access through your own hospital, then that's your portal and opportunity to get into it. So there is a relationship there. There's a strong relationship, and I think there's lots more work that needs to be done, and there are studies being planned. Okay,
great. One of the interesting things that I learned about when I was looking into it was around IBD patients, especially who have had stoma surgery or pouch surgery, and are men who have sex with men, and how that impacts their sexual identity if they're no longer able to receive anal sex, basically. And I found that really interesting as well, because there's all of these different components when it comes to sex and relationships. One of the things that came up was that they were told by their healthcare professional, or given the pamphlet of it's fine, even if you have a pouch or a stoma, you can still have sex. And I'm like, well, not me, not in the kind of sex that I want to have.
Yeah.
And so that's another part where, yeah, there's a lot that the healthcare system can learn from what patients are needing.
Yeah, absolutely. And I think it comes back again to listening to patients. And I think what's really important, what will be really important in that space as well, is actually working with patients to help them develop the trials and studies that answer the questions that are important to them.
Mm-hmm.
One of the things about research is traditionally the way that it's evolved and the way that we've delivered it, going back 20 years, it was probably in bigger hospitals that you got those opportunities. And so the access to research perhaps hasn't been as an inclusive and accessible as it could have been. I think things like Be Part of Research, which is, as a national registry that you can sign up to anywhere, in your own home, you can access research. It starts to break down some of the barriers. Now, I'm not saying that we are anywhere near breaking down all the barriers that exist in healthcare and in research, but it's a start on the journey. And I think one of the things we've learned is, one of the most exciting things I ever did was I worked with a patient who, with a charity, to design a study on outcomes following stoma surgery. And actually, when we started, it was a qualitative, so it was an interview based, so sort of a bit like this, talking to patients, really understanding and listening, and then evaluating what different patients said to try and create a mechanism for putting in place a package of care. And that study that we produced with a number of patients actually had the lead investigator, and I think this was probably for the first time in the country, the lead investigator was the patient. So it was groundbreaking, because what we said to the patient was, well, actually, we'll support you. Why don't you be the lead investigator? We'll train you, we'll support you. We'll put all the people around you to do the interviews and help with that. And yes, so it ended up being a patient-led research study. And that's the type of thing that I think will break down the barriers to the communities that you're talking about. And again, it's all about enhancing the access to research. If we can do it through registries, so you can access remotely, it's not just in big hospitals or big trusts, but also if we can empower patients to be involved from the ground up in designing the studies and then helping to run them, and then also being there to champion the outcomes so that they can get the message out to other patients.
Speaking of stomas, I'd love to hear about what research is happening in that space as well. I remember spending one evening on holiday looking up the history of stomas. Not very pleasant. Very glad to have my adhesive bag. But is there any new developments, any new things happening in that space?
So some of the surgeons I work with have done quite a lot of surgical research on things like hernia repairs post-operatively, parastomal hernia, using different meshes, different techniques, and trying to evaluate the sort of best ways to protect against hernia formation. And then when it happens, what's the best ways to resolve the hernia, to prevent it recurring, because kind of hernias and stomas and hernias and surgery are common complications. So there's been quite a lot of research in that area. While I don't know the exact details of that, I'm sure there's lots more going on at the moment. And one of the interesting things with stomas is, I think what we're seeing is the number of stomas that we see in patients that have stomas is probably beginning to decline over time. Partly because of the impact of some of the biologic drugs, so things like infliximab, because it was originally designed as a sort of rescue treatment to prevent you needing emergency surgery in colitis. As these new biologic drugs that have come through all these research trials start to have impact, what you see is there's a reduction in the need for surgery, and so. Over time, we might see less and less stomas, but certainly, surgery is still a really important and critical component of treating inflammatory bowel disease.
Mm-hmm.
And one area that we're looking at, which is really interesting, and it's not ulcerative colitis related, but it is surgical related, is we have just published a study looking at in Crohn's disease, if you have to have surgery, which is quite common. Once you've had surgery and your bowels join back together, we've looked at the impact of what's called bile acid diarrhea, which is a type of diarrhea that's caused in the post-operative period because you've removed a section of bowel that absorbs these bile acids. And what that does is it causes symptoms and you can treat it. But what we looked at was whether the bile acids could alter the microbiome and could increase the chances of your Crohn's coming back. And then we looked at giving a new drug, well, a drug that's available, but a drug specifically to target the microbiome and the bile acid diarrhea, and to see if we could reduce those chances. And so that was a small, what we call a feasibility study, looking at whether there was any changes at all in the microbiome. And what we showed was by using this bile acid medication to reduce the bile acids, you could see changes in the gut microbiome that are associated with a lower risk of the Crohn's coming back. So what we're now doing is looking to get a much bigger trial to look at the real impact on that, to identify exactly what it does for patients, the microbiome, but also to look at all those other things you talked about earlier, like quality of life. And there's a measure that you can look at work productivity and things like that. So we're going to look at all of that as well and try to find whether this medication will help to prevent the recurrence of Crohn's disease.
It's fascinating how specific you can get.
Yeah.
I wanted to touch on diet as well. When I was first diagnosed, and especially with it being UC, at the time I was told, oh, diet doesn't really impact UC because it's in the large intestine, so everything's kind of been mushed down and absorbed mostly by that point. And I never really noticed much change in my symptoms depending on what I ate, but I know other people with ulcerative colitis who do feel a bit more of a direct impact on with their diet and their symptoms. And then now with my stoma, obviously, I'm kind of a bit more conscious of my diet now with that than I was with my UC. And it also just happens that my taste in food is a stoma-friendly diet and always has been. So clearly this is my body telling me that you'll be fine. So what is going on in the diet space with ulcerative colitis? But obviously it's more important with Crohn's, or at least as far as I'm aware, it's more important with Crohn's.
Yeah, I think diet's so complex because it's so varied. The kind of, we refer to it as the heterogeneity of diet is so complex. But there's definitely studies coming out now that are showing that flare-ups with inflammatory bowel disease, both ulcerative colitis and Crohn's disease, are more commonly associated with what we now see as poorer quality diets. So healthier diets, a bit more balanced, less meat in diets, tends to be associated with less flare-ups, and there have been recent studies reporting that. So there's clearly a role to play, and diet is one of the environmental factors. Whether it's a primary factor or whether it actually has its mechanism of action through the gut microbiome, for example, it is really complex. The other thing I think that's really important for researchers to do is, I think, sometimes also take a step back and listen to the beliefs of patients with inflammatory bowel disease around this. And so there's been quite a bit of research done in specific populations that have specific diets. So the South Asian community, for example, there's been some research looking at dietary beliefs and understandings around, in their population, around the impact of diet on inflammatory bowel disease, so that we can also try to target the education aspects as well. So there's quite a lot of research ongoing. I think there'll be more coming, and there'll be more looking at how different components of diet might have that effect on the microbiome. There's bits that we sometimes refer to as prebiotics that can effectively adapt the microbiome. It's never ending.
It really is.
Research will just carry on and carry on. But the other thing again is I think just sort of coming back to those specific communities who want to look for research opportunities. So if it's something that you want to look at again that's diet focused, or you are from a particular community and you want something that is designed for you, then the best place to find those type of opportunities comes back again to things like Be Part of Research. When you register on there and you've kind of filled out the criteria that you need to complete, then it opens up all those opportunities.
What is Be Part of Research?
So it's a national registry. It's effectively a free research matchmaking service. So, we've never had this before. It's certainly not as widely available. And so anyone can sign up. It's on the NHS app. And what that does is it gives anyone anywhere in the country the opportunity to sign up, to complete a few questions around your condition, and then to be matched to studies that might be of interest to you. And you can search and look for all sorts of things on there. And so it's really exciting.
Do you have to have a specific health condition, or can it also just be anyone?
Yeah, anyone can sign up. So even as a kind of healthy person, yes. And interestingly, I signed up, and I'm not healthy, by the way. Well, I am healthy, but I'm not healthy.
Aren't we all somewhere in the middle?
Yeah. If it's you can so you can be unhealthy in bits of your body, but still be healthy in the rest, and then still get invited to healthy studies volunteers. So I got actually matched with a healthy volunteer study, which was a questionnaire. You can absolutely anyone can sign up.
Fab. And okay, why is it important for people to take part in research?
Yeah, so this is, I think, research underpins everything we do in healthcare services. So what we found with this huge development of research that's happened over the last 20 years is that participants in research get the personal benefits. So I think if you break it down, it's good for you. So there's lots of things in that you might get access to new drugs. By being in a research study, you are often involved in hospitals or trusts that naturally have higher standards of care. So those that are research active have better outcomes. They have lower mortality rates in their hospitals because the standard of care is higher just because they offer research studies. And actually, if you look at inflammatory bowel disease, colitis and Crohn's specifically, we looked at all the research that's been done in that area over the last 15 years. And we worked with IBD UK and Crohn's and Colitis UK. And we looked at some work that they'd done, which was a national patient benchmarking survey, where patients scored their own hospitals for the standard of care they received. And if you put together the two bits of data, so you take the patient benchmarking survey and you match it with the studies that are being offered in those trusts, you see a positive association. So the hospitals that are delivering and providing research studies, the patients say are providing better quality care. So there's lots of tangible associations there between the two. So get involved, be part of research. Beyond your personal benefit, beyond your care benefits, it's, I guess in a way it comes to some of the sort of altruistic future benefits. In our lifetime, we're going to start to see, diseases being almost eradicated by research studies that are going on. The the way that things are going and the research studies that are happening, we are really beginning to see that type of impact. So it's that the future generations will have more opportunities for treatment, improved outcomes and better care based on the studies that we're doing today.
Mm-hmm. So how does Be Part of Research make it easy for people to get involved in research?
Yeah, so Be Part of Research is an online, free research matchmaking service that makes it easier than ever to be involved in research. So you sign up, you choose your health and care research interests, and we match you with suitable studies and then send you relevant information to help you make a choice to get involved in those studies.
So what kinds of studies, what kinds of research are there currently happening?
Yeah, so again, I mean, it's one of the advantages of being part of research because if you go through that portal, you can search the huge numbers of different types of studies. Ones where we test a new drug, they may not be for everyone. And actually, when you go through Be Part of Research, you can find different types of studies. And throughout all the different diseases and conditions, there are studies that are what we call qualitative, and that's where you might get interviewed or you might get asked about your condition or you might get to do a survey. There are studies that are called quantitative or observational, and they collect just data. So you might just fill in a survey or a questionnaire each time you go to clinic, and so that's a type of study that you can get involved in. And then there are studies that are looking at for example, predicting why you might respond to different conditions. And those studies, for example, might have you come to your normal clinic appointment, but you have an extra blood sample, or you do a poo sample, or give another sample, and you do that regularly throughout the study. But also there's even studies on exercise and mental health using cold water swimming. So there's all manner of different types of studies you can get involved in.
Not just here, take a new drug.
Yeah, absolutely, absolutely. And actually, it is really important that we develop this because the different designs of studies and research, they all answer different questions that are important for us as healthcare providers, whether that's about what we do to help support patients, how we deliver healthcare services, how we predict your response to medication, how we give you medication. And we know that for some people, medication trials are things that they don't want to get involved in. So if you're not sure about that, start with something easier. Just do a survey or a questionnaire, get involved, sign up through Be Part of Research, do that. And then as you get more confident in being involved in research, you can go through that journey and do the other studies.
So if anyone watching or listening is interested in finding out more, where can they go?
So sign up online at bepartofresearch.uk.
Fab. Well, thank you so much, Matt.
And thank you. It's been lovely.
Yeah,
really
I've loved asking you all these questions about IBD and research.
Thank you. Really, really enjoyed it.